Ambulance emergency. Is the patient breathing? And is the patient awake? Hello there, I'm Blaine. I'm an emergency call handler in the Norwich Ambulance Control Room. Okay, so I've just taken a call for a 75-year-old female complaining of stroke symptoms. We went through the triage and I've arranged an emergency ambulance for her under a Category 2 response. Do you have difficulty breathing or swallowing? Okay, and have you ever had severe allergic reactions to the same or similar thing before? You have, okay. And do you have any specific injections or other medicines to treat this type of reaction? Okay, so you've got your EpiPen there. Right, okay, thank you. And has he ever been diagnosed with an aortic aneurysm? He hasn't, okay. And ask him to describe the pain. Thank you. So I've just taken a call for a 60-year-old gentleman complaining of severe abdominal pain. We've gone through the triage, and it is triage for a clinician from the ambulance service to review the call back and further assess his condition and get him the right care, which might be within the community or a referral to his GP to pick up at a later date. Ambulance emergency. Is the patient breathing? Your patient, okay. Tell me exactly what's happened. Okay. So severe chest pain going to your jaw, is that correct? Thank you, okay. And what's the full address of the emergency? Are you clammy or having cold sweats? You are, okay. And are you nauseated or vomiting? Okay. And have you ever had a heart attack or angina? You have. Which have you had? Heart, okay. And did you take any drugs or medications in the past 12 hours? Okay, so I've just taken that call, was for a 70-year-old alone at home, complaining of severe chest pain radiating into his jaw. Went through the triage and it was a Category 2 emergency response, and where he was alone with quite significant cardiac history, I stayed on the line just to monitor him, give him some reassurance until the crew arrived. So that was the end of my 12-hour shift here in the control room. Today I've taken 53 calls, ranging from GPs arranging admissions to hospital for patients, police speaking to police about jobs, fire service, and more importantly members of the public. Within them, taking calls for abdominal pain, chest pains, people having strokes or stroke-like symptoms, all triaged accordingly and got the most appropriate help, whether that be for an ambulance response or for a clinician to call back or be referred to a community service.
So we just finished up that job. We treated and transported the lovely lady to some definitive care in A&E. Now getting ready to be dispatched to our next job by our lovely colleagues in control.
General broadcast, I'm assigned a Cat 1 call for a 19-year-old female who is allergic to having an allergic reaction to peanuts. EpiPen is delivered, call handler still online, any queries that free and available, please contact control, November out. Good morning 426, the job was sent through to his company for us, a C2 response for a 75-year-old female who is complaining of stroke symptoms. The call handler on the line has said the patient is fast positive. Just give me an update when you're on scene, please. Just dispatched on a C2 for a 75-year-old female who's complaining of stroke symptoms. The call handler online has said the patient is fast positive. The crew, as soon as I get on scene, will give me an update if any other resources are required.